So you were telling us about some of the really nice birth experiences that you had in the hospital. Can you talk about the risk factors of the women that you saw? What types of women were you able to see, and which ones did you decide you needed to really have a physician take care of? Can you give us a little more information about that?
Okay, we have to, midwives, certified nurse midwives have to have a collaboration physician. And it was my sponsoring physician. I have to send out kudos to Dr. Lorenzo Simmons because he really allowed me to do midwifery. And some of the patients, they like someone that was 300 pounds or 350, they need to see physicians. Someone that was twin births, they needed to see a physician because I didn't have a physician in my office. With a certified nurse midwife, we do not have to have a physician in the office with us seeing patients. They had to have a referral base, and he was that referral base. Okay. So if somebody was chronic hypertension on multiple medications for high blood pressure, I referred it to the physician. Twins, as I state, and we one time had 4 twin sets come up in that office that year. They all got referred to physician. Now, anybody that was breech, because I don't do breech deliveries. So I sent it to the physician. A lot of cardiac disease, and we had some cardiac, that means heart. They had heart problems, or they had sickle cell disease, or they had any other influent like asthma, really bad asthmas. Mild asthma we were fine with, but someone that's on a lot of medication for asthma should be seeing a physician. Or someone in my practice had three or more C-sections before having a vaginal birth. They went to see a physician. Now, okay. 1 C-section and maybe 2, I did those in the hospital. Okay. And that was allowed. And some of them did it in the water.
So you're saying you did the vaginal birth after C-section, after the 1 or 2? Yes. Okay. Okay.
In the hospital. Okay.
Yes.
Yes. So we trailblazed a lot of stuff at Atlanta Medical Center. Okay. And for midwives to be able to do. So you need that collaboration. You need that person that believes in you. And that physician believed in me. He believed that when it was time to transfer a patient, I would transfer. If I had a question, I could call him. I could talk to him and ask him, what did he think about this person? And we had that good collaboration. And I believe that is what is needed now to keep the maternity, the mortality and morbidity down. We have to be able to talk to each other and communicate with each other. And, his medicine or my midwifery, we can work together with that. So women can get what they want and what they choose, choices.
So listening to you, what you're saying is that women who are pretty much without those kinds of complications or risks. So if I don't have high blood pressure, if I don't have twins, if I don't have heart problems, then I can see a midwife. And even if I did, that it's possible that I could still see a midwife along with the doctor. That's what it sounds like you're saying. Yes. So there's a lot of space in which women could actually be cared for by midwives safely, still have access to the doctor when it's needed. And then when time comes, the midwife has identified, I can no longer take care of you. I need you to be seeing the doctor now.
And I'm going to send you to someone that I trust, that he will take care of you and respect you just like I respect you. And they accept that, I think, much easier than going to someone don't know anything about.
That is great.